Yeah, awesome. Hey everyone, Dr. John Knab here. Today I want to dive into a big question. Is running bad for your back? A recent article by Dr. John Kruse, a psychiatrist and avid marathon runner, highlights research suggesting that running can actually promote spinal health. But is that the full story? Let's take a closer look. Kruse does admit that runners put a lot of stress on their bodies, including the fact that marathon runners take more than 50,000 steps during a race. That's a lot. But despite all of this pounding, it may not actually be the running that's causing the problem. In his case, his back problem started after spending a weekend with a pickaxe trying to dig out roots from a dead tree in his sidewalk. He goes on to point out that the general public and even doctors equate running with unnecessary trauma of the spine, including the discs and joints. Despite these common concerns, research suggests that runners tend to have healthier backs than non-runners. Kruse's article dives into these issues and points out a couple of things, including research suggesting that runners have better disc and vertebral height. Running may reduce spinal degeneration, and factors like posture, leg length discrepancies, body mass index, and flexibility may also affect spinal health. And finally, to balance things out, the article points out that while running is beneficial for many, some conditions may make it harmful. Dr. Kruse makes some great points. Running can strengthen core muscles, improve posture, and even increase disc hydration. But what does the broader research say? Let's explore both sides. Here's some research supporting running for back health. A 2017 study in Scientific Reports by Bellevue and colleagues found that runners have better intervertebral disc hydration or water content compared to non-runners, suggesting a protective effect on spine health. In 2023, the British Journal of Sports Medicine published a study indicating that controlled running programs helped individuals with non-specific chronic low back pain reduce symptoms and improve mobility. Running has also been shown to promote endorphin release and reduce chronic pain perception, making it a potentially valuable tool for back pain management. So for many, running is not only safe, but actually beneficial for spinal health. But what about the other side of the argument? Here's some data that expresses concerns about running with back pain. A 2021 article in the Journal of Orthopedic and Sports Physical Therapy found that high-impact activities like running could exacerbate pain in individuals with disc herniation or spinal instability. And a 2020 article in the Sports Medicine Journal found that overuse injuries are common in runners, including those affecting the lower back due to improper form or insufficient core strength. And finally, runners with a history of spinal fractures or instability may be at risk for worsening symptoms, especially without proper strength training. So, what does this mean for you? Well, like most things in medicine, it depends. Running isn't a one-size-fits-all solution. While it can be great for some, others might need to modify their training or explore alternative activities. Okay, what if you're a runner, even someone who has perfect form, and you're still struggling with back pain? Is surgery the only option? No, of course not. There are many steps you can take to try to heal your back without surgery, and it's always a good idea to explore all reasonable options before going under the knife. Here are some non-surgical options that the Kruse article didn't mention. Shockwave and EMTT therapy. These non-invasive options stimulate tissue regeneration and reduce pain. Laser therapy helps with inflammation and promotes healing at the cellular level. PRP, or platelet-rich plasma, uses your own blood's healing factors to repair damaged discs and joints. And the disc seal procedure, which is a minimally invasive technique that seals disc tears, reducing pain and potentially preventing surgery. Key takeaway: running can be a part of a healthy lifestyle, but it's not for everyone. Your condition, biomechanics, and training habits all matter. If you're dealing with back pain, consider non-invasive and regenerative treatments before jumping into surgery. If you're unsure, consult a physician specializing in musculoskeletal health. Well, that's it. If you found this video helpful, please make sure to like, subscribe, and drop a comment below. What's your experience with back pain and running? Help us by telling us what's worked for you. Let's keep the conversation going. See you next time and have a great day. I gotta start running.